Welcome to the Congress Agorà 2022. We are here with Dr. Claude Dalle from Paris. Bienvenue. What are the innovative contents, the confirmation that you want to highlight regarding your participation at the Congress?
Thank you to ask me this question. I went here to present can virus help us to age? Can we age with viruses? Because with COVID-19, we have highlighted a lot of things about the brain, the gut, and the link with viruses. Years before, about 5 years before, we had a lot of suspicion on the link between virus and Alzheimer's disease and Parkinson disease and multiple sclerosis. But what we learned with COVID-19 is that this kind of virus and all the herpes family virus can modify the microbiota, it can modify the brain. When you have this virus on a long term, you can destroy your vagal nerve. But the vagal nerve is the driver of the functions of the gut, the heart, and the lungs. So if you attack this nerve, you attack these three organs. And when we age, we have less immunity.
Of course.
So when a virus penetrates in your body, it can replicate easily, more easily than if you're young. In this case, it can easily destroy your vagal nerve. And you know that the communication between the gut and the vagal nerve happens between the brain, happens through the vagal nerve. But when you modify the microbiota, you modify also the metabolisms. You modify the absorption in the small intestine of carbs, proteins, lipids, and so on. So viruses can deeply modify our body functions and destroy our immunity. And we know already with herpes virus family, for example, genital herpes, labial herpes, EBV, CMV, the cervix HPV virus, all these viruses can lead to neurodegenerative disease and cancers. It's very well known for HPV and the face cancers, for example. So now, from 1 century, we have less bacteria, we have less microbe infections because we have antibiotics, we have hygienisms, we have vaccination. But we don't take care about the viruses. And in the future, we will have more and more viruses and autoimmune disease. This was my lecture. So we should take care to long COVID. These people are very risky to get Alzheimer's disease and Parkinson's disease. And actually, neurologists begin to see more Parkinson's disease with COVID-19 and probably Alzheimer's disease. So this is a great challenge for the future to try to prevent the attack of the body by viruses when we age.
Very interesting, your contribution about viruses. Another question. Are there any specific recommendations for colleagues regarding what you indicated in the previous questions?
Yes, for my colleagues, I want to share the facts that for a patient, they should take care of carbs. Because what we know is that the detoxification of the brain happens when you sleep. If you don't sleep enough, you cannot detoxify your brain. And you cannot detoxify viruses and beta-amyloid plaque and so on. But to detoxify, you should also have not too much carbs in your body. Because if you have a lot of carbs at dinner, you have insulin resistance, and insulin resistance blocks the detoxification of the brain during the night. If you do this one night or sometimes, it's not risky. But if every day you eat a lot of carbs at dinner, you block your brain detoxification and you increase your risk of Alzheimer's disease, for example. And Alzheimer's disease is called the diabetes type 3. It means carbs are very risky for Alzheimer's disease, particularly at dinner. So I want to share this for my colleagues. For dinner, take to your patient low carbs, please.
Please.
Particularly when you age. When you're young, it's not a problem. Because you have a big detoxification.
Of course.
You can eat carbs. Yeah? You can drink Coca-Cola and so on. But when you are 60, no, stop.
But how many hours it's better to sleep?
it's better to sleep for human people between 6 and 8 hours.
Okay.
People with 4 hours or more, less than 4 hours, have more risk of mortality, diabetes, and neurodegenerative disease. And also if you sleep too much. If you sleep more than 8 hours, you have the same risk, and also stroke and so on.
Another question. Are there any practical clinical findings for patients or recommendation that you consider useful to disclose for safe and ethical aesthetic medicine?
Yes. I think to prevent this kind of disease, we should be aware, check for our patient the levels of replication of viruses, EBV, CMV, and so on. We should also, in this case, if we find a big replication, we should not hesitate to treat the patient with antiviral, low dose on the long term. On the long term means 6 months or 1 year. For example, acyclovir or valacyclovir. These two therapeutics, low dose on the long term, are very useful to prevent Alzheimer's disease and so on. We have a lot of studies now, a lot of publication on this.
What new treatments are you excited about?
In anti-aging, we have a big excitation on metformin. Because metformin, is an anti-diabetic drug. But now we know that it's a prevention of heart disease, gut disease, neurodegenerative disease, and so on. And immune disease and many, many diseases. We think in animal studies and also in human studies it's beginning that when you take metformin on a long term, low dose, always the same thing, you decrease of 30% the risk of many diseases. And this helps you to be lean, to get energy. Personally, I take metformin since a long time, since more than 6 years, and I continue to do this. And for my patient, I prescribe metformin. But what we know also is that a molecule from plants, which is called berberine, is nearly similar to metformin in the effects. So you can use it if you want. It's without prescription.
Yeah.
It's easy to find. Yeah.
Very interesting, everything you told us. I thank you very much for your contribution.
And I thank you also. And I thank you, Alberto Macieron, for this very nice congress, because it's now a huge one.
Thank you, Dr. Dalle.
Thank you. Bye-bye.